The string quartet played Mozart in the corner of the country club's grand ballroom as Boston's medical elite mingled over champagne and canapés, their conversations a mixture of professional accomplishments and charitable contributions. I stood near the silent auction tables, watching my family work the room with the practiced ease of people who'd built their social status on medical prestige. The Martinez family has always been committed to advancing cardiac care, Dad was explaining to Dr. Whitfield, the chief administrator of Mass General, his voice carrying that particular blend of authority and humility that made him so effective at fundraising events. At 55, he commanded respect as one of Boston's most successful cardiologists, his reputation built on 2 decades of saving lives and building professional relationships. Robert's contributions to the cardiac wing have been extraordinary, Mom added, her diamond bracelet catching the chandelier light as she gestured toward the auction items. This family understands the importance of supporting medical excellence. I sipped my wine quietly, accustomed to being invisible at these gatherings where my parents showcased their professional achievements while my sister Amanda basked in reflected glory. At 28, I'd grown used to standing on the periphery of their medical dynasty, the family member whose accomplishments didn't warrant mention in conversations about surgical innovations and research breakthroughs. Speaking of medical excellence, Dr. Whitfield said, I understand congratulations are in order for Amanda's engagement. Another physician joining the Martinez family legacy. Amanda beamed, her engagement rings sparkling as she touched her fiancé's arm. Thank you, Dr. Whitfield. David and I are so excited. The wedding is planned for next month. We couldn't wait to start our life together. How wonderful, Dr. Whitfield replied. And will the whole family be able to attend? I know how challenging it can be to coordinate schedules in medical families. Dad's laugh was warm and confident. Of course we'll all be there. Family celebrations take priority over everything else, even if we have to reschedule a few minor procedures. My stomach tightened at his casual reference to minor procedures. What he didn't mention was that my mitral valve replacement, scheduled for the exact same day as Amanda's wedding, had been deemed one of those minor inconveniences that could be postponed for more important family priorities. Robert, you're too modest, said Dr. Harrison from cardiac surgery. I heard you're handling some complex valve cases this month. Surely those require your full attention. Nothing that can't wait, Dad replied dismissively. It's just a little valve replacement, routine procedure really. My daughter Emma has been dramatically about a minor heart condition, but you know how young people can be about medical issues. The words stung as they were meant to. My minor heart condition was severe mitral regurgitation that required immediate surgical intervention to prevent heart failure, but Dad's medical opinion apparently classified my potential death as less urgent than Amanda's wedding photography timeline. What made his dismissal particularly galling was that standing just 20 feet away was Dr. Catherine Hayes, the chief of cardiothoracic surgery who would be performing my routine procedure. The same Dr. Hayes who'd spent the past 2 weeks trying to coordinate with my father about preoperative planning and family medical history, only to be told that the surgery would need to be delayed because of scheduling conflicts. Family should always come first in medicine, Dad continued, raising his glass in a toast. We save lives because we understand what really matters, the people we love. The irony was breathtaking. He spoke about saving lives while actively endangering mine, about loving family while prioritizing one daughter's social event over another's survival. But tomorrow's conversation between Dr. Hayes and the hospital's medical ethics board would provide an excellent opportunity to clarify which medical procedures actually qualified as minor. Emma, you're being unusually quiet tonight, Mom observed, finally acknowledging my presence. Are you feeling well? You're not having more of those anxiety episodes about your little procedure, are you? My anxiety episodes were her explanation for my concerns about postponing life-saving cardiac surgery, as if fearing death from heart failure was a psychological problem rather than a medically appropriate response to delayed treatment. I'm fine, Mom. Just listening to all the medical expertise. Well, try not to worry so much, she said kindly. Your father knows what's best medically. A few weeks won't make any difference for something so routine. A few weeks might kill me, according to the cardiothoracic team that had been monitoring my progressive symptoms, but pointing that out would only earn another lecture about being dramatic and anxious about standard medical care. The charity gala continued with its familiar rhythm, physicians discussing breakthrough treatments while selecting expensive auction items, medical administrators praising innovative research while planning vacation packages, cardiac surgeons debating surgical techniques while bidding on wine collections. Through it all, my family maintained their performance as the devoted medical dynasty whose commitment to healing inspired their charitable generosity. The Martinez family exemplifies what we hope to achieve in medicine, Dr. Whitfield announced during the evening's formal program. Their dedication to cardiac care has saved countless lives and advanced our understanding of heart disease. Dad stood gracefully to accept the recognition, his speech a masterpiece of humble professionalism. Medicine is about more than individual achievement. It's about family, community, and the understanding that we serve something greater than ourselves. The applause was enthusiastic, colleagues acknowledging a physician whose reputation seemed unassailable. What they didn't know was that his dedication to cardiac care apparently had exceptions when family social events conflicted with actual cardiac emergencies. Over the following days, as Amanda's wedding preparations intensified, my family's priorities became increasingly clear. Every conversation revolved around venue decorations, catering menus, and photography schedules, while my upcoming surgery was treated as an annoying scheduling conflict that interfered with more important family obligations. "We need to finalize the seating chart," Mom announced during Sunday brunch, spreading wedding diagrams across the table like battle plans. "The ceremony is in 3 weeks and these details matter for photographs." "Has the florist confirmed the bouquet arrangements?" Amanda asked, reviewing her checklist of wedding essentials. "I want everything perfect for the photos." "Everything will be beautiful," Dad assured her, his paternal pride evident. "Your mother and I have handled every detail. Nothing will interfere with your special day." The promise was touching, especially since ensuring Amanda's special day required postponing my cardiac surgery by 6 weeks. A delay that my surgical team had reluctantly agreed to only after extensive family pressure and Dad's professional influence. "What about Emma's little procedure?" Amanda asked with false concern. "I hope that won't create any family drama during wedding week." "Don't worry about Emma," Mom said dismissively. "Your father has explained that the surgery is completely routine. She's just being anxious about something minor." The cognitive dissonance was remarkable. They'd convinced themselves that my valve replacement was so insignificant that delaying it for a wedding posed no risk, while simultaneously using Dad's medical authority to pressure surgeons into accepting the dangerous postponement. What made their behavior particularly infuriating was how they'd rewritten medical reality to justify their priorities. In their version of events, my heart condition was a minor inconvenience being exaggerated by an anxious patient, rather than a life-threatening emergency requiring immediate intervention. "I've been thinking about the rehearsal dinner," Dad said, reviewing his own wedding checklist. "We should invite the entire cardiac department. It's important to maintain professional relationships, and they'll appreciate seeing the family celebrate together." The suggestion was brilliant in its audacity. Invite the very physicians who'd been pressured to delay my surgery so they could witness the family celebration that had necessitated the medical malpractice. "Wonderful idea," Mom agreed. "Dr. Hayes and her team have been so understanding about rescheduling Emma's procedure. They deserve to see how much we appreciate their flexibility." Their flexibility had been achieved through professional coercion and medical authority abuse, but acknowledging that reality would have undermined their narrative about routine procedure scheduling. The breaking point came when Amanda announced her final wedding timeline. "I want everyone at the venue by 8 a.m. for hair and makeup. The ceremony is at 4, reception at 6, and dancing until midnight. It's going to be the perfect day." Perfect required my entire family's presence for 14 hours of wedding festivities, occurring exactly when I should have been undergoing cardiac surgery to prevent heart failure. But according to their medical assessment, dancing at Amanda's reception was more important than ensuring my survival. Tomorrow's ethics board meeting would provide an excellent opportunity to clarify which events actually qualified as medical emergencies. The monthly medical ethics board meeting at Massachusetts General Hospital was typically a routine affair. Case reviews, policy discussions, administrative updates that interested only the physicians required to attend. This Tuesday's meeting, however, promised to be significantly more impactful. The boardroom on the hospital's executive floor commanded respect with its mahogany furniture and portraits of distinguished physicians who'd shaped Boston's medical landscape. Today's attendees included the most prestigious names in cardiac medicine, department heads, surgical directors, and medical administrators whose decisions influenced thousands of patients. I'd been invited to observe from the gallery reserved for medical students and research staff. Dr. Hayes had suggested my attendance would be educational, given my first-hand experience with the case being discussed. Today's primary agenda involves a case study in medical ethics and professional conduct that requires immediate board attention, announced Dr. Margaret Chin, the hospital's chief medical officer. Her reputation for uncompromising medical standards made her the perfect choice for chairing discussions about professional misconduct. The room's energy shifted as physicians recognized the serious implications. Ethics cases involving board-certified physicians usually meant careers were about to be examined under the most demanding professional scrutiny. The case involves Dr. Robert Martinez, a senior attending cardiologist with 20 years' experience at this institution. Dr. Martinez recently pressured our cardiothoracic surgery department to delay emergency cardiac surgery for his daughter, citing family scheduling conflicts as justification for postponing life-saving treatment. Medical documentation appeared on the presentation screen: surgical recommendations, risk assessments, family consultation notes. Every piece of evidence carefully compiled to demonstrate the medical necessity of immediate intervention. The patient, Emma Martinez, age 28, presents with severe mitral regurgitation requiring urgent valve replacement to prevent heart failure and potential death. Our cardiothoracic team, led by Dr. Catherine Hayes, recommended immediate surgical intervention. Dr. Hayes stood to address the board, her voice carrying the professional authority that had made her legendary in surgical circles. The patient's condition is critical. Delaying surgery increases mortality risk exponentially. Any cardiologist should understand the urgency of this case. However, Dr. Chin continued, Dr. Martinez used his professional influence to demand a 6-week postponement, describing his daughter's surgery as just a little valve replacement and a minor procedure that could wait for family celebrations. The room's attention focused like a surgical laser. Experienced physicians were stunned by the casual endangerment being documented. Investigation revealed that Dr. Martinez prioritized his other daughter's wedding over emergency cardiac surgery, referring to the life-threatening procedure as routine, while pressuring surgical staff to accommodate social scheduling. Documentation continued appearing: recorded conversations, email exchanges, witness statements from surgical staff who'd been pressured to compromise medical judgment for family convenience. Dr. Martinez informed colleagues at charity events that his daughter was being dramatic about a minor heart condition, while simultaneously using his medical authority to delay the surgery that could save her life. Dr. Hayes provided additional testimony that was devastating in its clinical precision. No competent cardiologist would consider severe mitral regurgitation a minor condition. Dr. Martinez's characterization of this case demonstrates either fundamental medical incompetence or willful endangerment of his own daughter. The board members absorbed this information with the gravity it deserved. Professional misconduct cases involving family members carried special significance. Physicians who endangered their own children couldn't be trusted with other patients' lives. The wedding Dr. Martinez prioritized over his daughter's survival is scheduled for the exact date when emergency surgery should occur. He has chosen social celebration over medical necessity, using his professional influence to coerce surgical staff into accepting dangerous delays. Dr. Chen's voice carried the cold authority that had made her legendary for holding physicians accountable. This represents the most egregious violation of medical ethics and parental responsibility this board has encountered. A physician who describes his daughter's life-threatening heart condition as minor and prioritizes wedding planning over cardiac surgery has demonstrated complete unfitness for medical practice. The board's unanimous vote was swift and decisive. Dr. Martinez's medical license was suspended immediately, pending formal hearings that would determine whether he could ever practice medicine again. The aftermath was immediate and devastating. Dad's suspension from medical practice was announced within hours, sending shockwaves through Boston's cardiac community. Colleagues who'd respected his expertise for decades struggled to comprehend how a cardiologist could prioritize a wedding over his daughter's heart surgery. Mom called that evening, her voice shaking with rage and confusion. "Emma, what have you done? Your father's career is destroyed because you couldn't wait a few weeks for a routine procedure." "I didn't do anything except survive long enough to need life-saving surgery," I replied calmly. "Dad destroyed his own career by calling my valve replacement minor and pressuring surgeons to delay emergency treatment." Amanda's response was more complex. Learning that her wedding had been prioritized over my potential death created cognitive dissonance that shattered her understanding of our family dynamics. "Emma, I had no idea it was that serious. If I'd known, you would have postponed the wedding," which is exactly what any normal family would have suggested when their daughter needed emergency cardiac surgery. The medical community's reaction was swift and merciless. Dad's colleagues who'd once sought his consultation on complex cases now viewed him as a cautionary tale about medical judgment and professional ethics. His 20-year career was effectively over. The financial consequences were equally severe. Without medical income, my parents couldn't maintain their lifestyle, country club memberships, or the expensive home that had hosted so many professional gatherings. The social standing Dad had built through medical achievement evaporated along with his license. Amanda postponed her wedding indefinitely, too devastated by the revelation to celebrate. The event that had seemed more important than emergency surgery became impossible when she realized her perfect day had required risking her sister's life. My surgery was rescheduled immediately, performed by Dr. Hayes with the urgency the procedure had always required. The valve replacement was completely successful, and my recovery progressed excellently under the care of physicians who understood the difference between routine procedures and life-threatening emergencies. 6 months later, I received a promotion at the medical research firm where I worked, leading studies on cardiac outcomes that would influence surgical protocols nationwide. My work, dismissed by my family as unimportant, was actually advancing the same cardiac care that my father had once claimed to champion. Dad still sends occasional messages, usually around holidays, with desperate attempts at reconciliation that ignore the fundamental issue. He endangered his daughter's life for a social event and lost his medical career as a consequence of that choice. Dr. Hayes offered perhaps the best perspective during my final follow-up appointment. "Emma, some physicians forget that medicine isn't about personal convenience or family celebrations. Your father confused social priorities with medical judgment, and that confusion cost him everything that mattered professionally. The new valve works perfectly, pumping blood through a heart that learned to function independently of family support. Sometimes the most important surgery removes more than just defective tissue. It removes toxic relationships that prioritize celebrations over survival." Medical ethics exist because patients' lives matter more than physicians' personal agendas. When doctors forget that principle, even with their own children, they lose the right to practice medicine. And sometimes the most important lesson is that family members who view your survival as negotiable don't deserve access to your life.